AstraZeneca have been manufacturing in the expectation that it will be approved, and already we know it's in use in the island of Britain and in Northern Ireland. So we know that it is there to be got. So do we know how much of a stockpile they have and how quickly they can deliver massive quantities to the European countries? We get 1.1% of it because GPs and pharmacies will be able to handle this so easily. And that's the game changer, really, in terms of numbers.
That's it. So Pfizer has to be stored at minus 70 degrees, Moderna at minus 20 degrees. They can still go out to GPs, but obviously it's much more difficult for those reasons because with Pfizer, for example, the moment you take it out of the freezer, you have 120 hours to get it into people's arms. As you say, AstraZeneca is the game changer because it can just be kept at refrigerated temperatures. So the provisional agreement we have and the provisional planning we have is for quarter one. So by the end of March, about 600,000 doses. It's a 2-dose regimen, so that would be about 300,000 people. When you add Pfizer and Moderna to that, our planning is that we'd have just a little less than 1.4 million doses in the country by the end of March, so that's within about 11 weeks' time, and that will vaccinate about 700,000 people. Now, what's really encouraging about that, Pat, is 700,000 people covers the first 3 cohorts in the prioritisation. That's the entire long-term residential care sector. So that's all of the nursing homes, all 589 nursing homes, but it's also the mental health facilities and the disability facilities. It's all 150,000 frontline workers, and it's all 500,000 or thereabouts people over the age of 70. So any of your listeners who are sitting at home right now are wondering, if they're over the age of 70, they're wondering, when are they going to get vaccinated? That's the question on everybody's mind. What we can say now is, based on provisional amounts, these all still have to be agreed, AstraZeneca still has to be authorised, is that everyone over 70 would have a first dose and most people a second dose within the next 11 weeks. Then in quarter two, originally we were looking at about 1 million doses a month, so that would be 3 million doses in quarter two. We can add to that. So yesterday, as I said, we signed off on Pfizer. That would add about 700,000 doses in quarter two. What that all boils down to, Pat, is about 1.8 million people in quarter two. Now, what that gives us is cohorts 1 to 12 on the prioritisation, and I can go through them with you if you like.
Just bring us to number 12. I mean, that's the and number 13. Who's not getting it might be the simplest thing to do. At the end of quarter two, which is the end of June, who will be left to be vaccinated?
Well, so who will be vaccinated is the 3 groups we said, right? Then other healthcare workers, people age over 65, key workers involved in the vaccination programme, people aged 18 to 64 with certain underlying medical conditions, people aged 18 to 64 living or working in crowded setting, key workers in essential jobs who can't avoid the risk of high exposure, people in education, and then people aged 55 and upwards. So for quarter three then, which is what's left, and we would plan, it's again highly provisional, but the planning would be that by the end of quarter three, the final 3 groups could be done, and that's other workers in occupations important to the functioning of society, anyone else really from the ages of 18 and upwards, and then people aged under 18.
Okay. So by the end of quarter two, a lot of the people all of the people, in fact, who would typically be in the profile of those who get very sick will be vaccinated. I mean, that's what it looks like. There are exceptions, we know, people who have no underlying conditions whatsoever, who are fit as fleas and suddenly fall a victim to COVID-19. But by and large, a huge cohort will be vaccinated who therefore cannot get infected. The jury's still out on whether or not they can pass on infection, but it's highly unlikely because if they don't have a huge amount of virus in their noses and throats, their ability to pass it on will be limited. But we'll defer to Luke O'Neill on the science of all of that. So that's pretty good news all round. By the end of June, a huge proportion of the vulnerable population will be protected.
Yeah, I think that's exactly right, Pat. And actually, really before the end of June, because there's people in quarter two up to and including that level 12 or cohort 12 who really aren't at risk. So by the end of quarter one, I think what's quite exciting is that by the end of quarter one, which is in just 11 weeks, the long-term residential care, remember, more than 1 in every 2 COVID death in wave 1, 52% of them came from the nursing home sector. So all of them vaccinated, all frontline healthcare workers vaccinated, and everybody over the age of 70. Now, give or take, some people will be getting their second dose into April. It's not a perfect cutoff. But when you've got those 3 groups done, the other group that I'm very focused on is people with underlying medical conditions as well. And there are others who are at risk. But certainly as we move through quarter 2, those who are most at risk will be vaccinated with the 2 doses. Yeah. And then, to your point, Pat, what we're doing is we're minimizing the chances for this virus to make people really sick and ultimately to kill people.